Eyelid conditions, a comprehensive guide. This presentation provides a comprehensive overview of common eyelid conditions, including their causes, symptoms, and treatment options. We will delve into various conditions such as Stye, Chalazion, Ptosis, Trachoma, Trichiasis, Entropion, and Ectropion. Understanding these conditions is crucial for proper diagnosis and effective management. Stye, hordeolum externum. Etiology. Stye is common in young adults with refractive errors and muscular imbalance and may occur in crops. It is often caused by Staphylococcus aureus. Clinical features. A painful swelling appears on the lid margin. The inflamed gland becomes hard, swollen and tender, and soon an abscess forms. Treatment. Hot compresses are beneficial in the initial stages of the stye, but when the abscess is formed it should be evacuated by a small incision. Application of antibiotic ointment prevents recurrences. If crops of styes occur, diabetes mellitus must be excluded and a course of systemic antibiotics may be prescribed. Hordeolum internum and Chalazion. Hordeolum internum. Hordeolum internum is a suppurative inflammation of the meibomian gland which can occur due to secondary infection of a chalazion. Chalazion. Chalazion is a chronic granulomatous inflammation of the meibomian gland. Ptosis. Etiology. Etiological classification includes following types of ptosis. Myogenic. Maldevelopment of levator palpebrae superioris. Aponeurotic. Most common form of acquired ptosis and caused by stretching and disinsertion of the levator aponeurosis owing to frequent rubbing of the eyes, wearing rigid gas-permeable contact lenses, and traction during ocular surgery etc. Neurogenic. Frequently associated with congenital oculomotor nerve palsy, Horner's syndrome, and Marcus-Gunn-Jaw-Winking syndrome. Mechanical. Caused by excessive weight of the upper lid, it may be due to multiple chalasia, neurofibromatosis, excessive cicatrization of tarsal plate and trachoma, and benign and malignant tumors of the upper lid. Traumatic. Trauma to the LPS muscle or its aponeurosis. Ptosis. Clinical features and treatment. Clinical features. If the drooping of eyelid covers the pupil, the only visual disturbance occurs. To see the objects, head should be tilted back to draw the lids upwards. Lid covers most of the cornea and palpebral fissure gets narrowed. Treatment. Congenital ptosis is treated only by operative correction. Acquired ptosis requires treatment of the underlying cause. Trachoma. Causative organism. Chlamydia trachomatis, Bedsonia group of organism. Clinical features. The course of trachoma is arbitrarily divided into 4 stages by Macallan. Stage 1. Conjunctival changes, incipient trachoma. Incipient trachoma represents the earliest stage of the disease with minimal papillary hyperplasia and immature follicles on the upper palpebral conjunctiva associated with microponus. Stage 2. Corneal changes. Manifest trachoma. Mature soft saga-grain-like follicles in the superior tarsal conjunctiva, papillary hypertrophy, gross ponus, and limbal follicles or Herbert's pits characterize this stage of trachoma. Stage 3. Stage of cicatrization, healing trachoma. Cicatrization or scarring develops usually around the necrotizing trachoma follicles. Besides scarring, some or all the signs of stage may second be present. Stage 4. Stage of complications, healed trachoma. The follicles and papillary hypertrophy disappear, and the palpebral conjunctiva is completely cicatrized and smooth. The scar may be thin or dense. Pannus resolves and the presence of incomplete or complete Herbert's pits may be seen at the limbus. Complications: Entropion, Trichiasis, xerosis of conjunctiva, corneal opacities, corneal ulcer, Chalazion, etc. Treatment: I. Painting with CuSO4 if no corneal ulcers / painting with AgNO3 if ulcer present. 2. Oral and local antibiotics. 3. Atropine 1% ointment if cornea is involved. Trichiasis. Definition: Trichiasis is a condition where a few cilia, eyelashes, are misdirected backwards, inverted, and they cause injury to cornea. Etiology: Trichiasis is a condition where a few cilia are misdirected backwards and they rub against the cornea. Clinical features: foreign body sensation or irritation, lacrimation, photophobia, and pain are common symptoms of trichiasis. The misdirected lashes may rub against the cornea or cause corneal erosions and vascularization. Treatment: misdirected cilia have to be removed by epilation. Destruction of hair follicle by diathermy or electrolysis. Plastic surgery. Entropion and Ectropion. Condition. Description. Types. Clinical features. Treatment. Entropion. The lid margin is rolled inwards. The inturned eyelashes rub against the cornea and the conjunctiva and cause irritation, watering and photophobia. Spastic, cicatricial, involutional, senile, congenital. Epiphora, watering of eye, pain, discomfort, photophobia, corneal lesions, etc. Spastic entropion due to bandaging can be relieved by discarding the bandage. Persistent spastic entropion may need an injection of 1 ml of 80% alcohol subcutaneously along the margin of the lid. Cicatricial entropion usually needs surgical repair, e.g. tarsectomy. Ectropion. Rolling out of the lid margin is called ectropion. Spastic, cicatricial, senile, paralytic, mechanical. Watering of eye, conjunctival congestion, exposure keratitis, etc. Spastic proper bandaging. Cicatricial excision of the scar and skin grafting. Senile and paralytic plastic surgery repair of the lower lid.